When we see the cascade in motion, we don't need as much as this one as we do this one, and so forth, because we set off this series of reactions that are going to come into play, and we end up getting that formation. Now, stuff can go wrong with this prothrombin and thrombin. That will be something that you will hear when you get out into the clinical world, because there can be other reasons that people have problems with clotting of their blood. So you may hear the doctor say, we need to do a PTT, a prothrombin testing time. Okay? Meaning the blood's not clotting like it should, and let's check to see about this factor. Okay? So that activation of factor 10, the one where the extrinsic and intrinsic met at the common, and we got the factor 10, what that's going to do, it will lead to the production of the prothrombin. So prothrombin is very important. What the prothrombin does, basically when that's activated, it will form thrombin. Now, thrombin, look why thrombin is needed, converts fibrinogen into fibrin monomers. What's a monomer? Mono means what? One. If I need that thread to be formed, and I'm looking at a protein, what's the thing that the protein can give me? A monopart would be one part, an amino acid. And if I can get that and get those amino acids to form together, I'm going to get my thread, the fibrin. So people can have problems with this. It can actually be tested, okay? And what we'll end up doing, we'll get the strands, the thread. We have a positive feedback cycle that is occurring. However, it only occurs to the point we seal the break. Once that break is sealed, this stops, okay? No more positive feedback. Usually, there is a bleeding time that takes place. A millimeter. About how big is that? Tiny, right? Now, go back to thinking about the paper cut. That would be roughly, might even be more than a millimeter, but still, how quickly should it stop bleeding? It should be under a minute. That it should stop bleeding, and it should be closing up. If it takes longer than that, something's wrong. That's when the PTT might be ordered. Now, once we have a blood clot, it's very important that we just don't simply keep the clot there, because it is obstructing blood flow. So, once we've stopped the bleeding, got all of our factors, things are pretty much under control, we're good to go, we got to do something to break up that clot. So, once we get the clot formed, one of the things that becomes important is for those platelets to release their growth factors. Stimulate that blood vessel to repair. And that means for the two ends to repair, okay, to meet together. So we end up getting the stimulation for the mitosis, which hopefully begins to repair the vessel. If we can get that process going, we need to make sure that we can break down that clot. Some of the part of breaking down that clot, we got to break down the fibers that help to form it. So we have to make sure that we have an enzyme that will break the fibers. Don't you love how they named it? Somebody got inventive in lab that day, sort of like kill the clot. I mean, that's what I think of. But anyway, you know, so we begin to get the breakup of the clot. That requires some materials, some chemicals. Once again, we're starting a positive feedback loop. We get the production of plasmin, which will come from something called plasminogen. That helps us break up the clot, break up the fibers. Because if we break up the clot, what we're doing is we're keeping it from staying built up as repair occurs, possibly breaking apart or breaking off. And if it does that, what does it become? But one that travels is called a what? Thrombus. Okay? Meaning it could travel somewhere else and cause a problem and kill you. So if we've got all of these little factors, all of these little chemicals in place, we should be able to stop the blood, form the clot, repair the vessel, break the clot, be done. Now, it doesn't happen all within a certain amount, you know, within a very quick time frame. It takes a little bit of time. Now, once the healing has occurred, how do we keep all of these clotting factors that are present, these platelets that are present, from doing inappropriate clotting? Because we can't just simply walk around with the clots forming in the body. If you know anybody who's prone to clots, that's not a good thing, okay? So, we got the prostacyclin, the stuff inside the vessels that say, go away, clot, don't need you here. We have the ability to keep thrombin diluted, because thrombin, prothrombin, fibrin, we're able to keep it diluted, meaning when the blood's flowing, we don't have time for that to be working unless it's needed. And that means if we had the clot begin to form, stuff slows down, that's going to activate the thrombin. But as long as blood's flowing freely, we keep it diluted. Do you guys remember the white blood cells? One of them secreted what? Heparin, which is a natural anticoagulant. And those cells stay right around the vessels of the body. They're called mast cells. Mast cells migrate. It's like they just migrate around the vessels so that the heparin's present to keep the blood from clotting, which is really kind of cool. Then we have something from the liver called antithrombin. So that's floating around out there in the blood, keeping the thrombin from becoming the clot factor. So we have ways that will keep the blood from clotting inappropriately. We can have clotting disorders, basically any type of deficiency and a clotting factor that shuts down the coagulation cascade. Hemophilia is one of the biggest ones. We have different types of hemophilia. We can have 8, 9, 10. I think there are some others out there too. Hemophilia factors are affected. Hemophilia is linked. It's a sex link. It's found on the X chromosome. For the most part, note my terminology, males are affected because females have a second X that can correct it. Males only have XY. Okay, so that's why the males usually suffer the hemophilia. One that's not sex-linked is on an autosome is the hemophilia C. I one time looked up all of the hemophilias, but I can't remember what I did with the paperwork. Some of the other disorders that we can have a thrombosis, which is an abnormal clotting. This gives us a thrombus and usually occurs in the leg gains of inactive people. One of the things they tell you now, if you're taking a long flight, make sure that you get up, move around. You know, if you have to, wear the compression socks. The pulmonary embolism, this is where if the clot breaks free, it can travel from the veins to the lungs. So people who end up getting the clot in the leg or somewhere else in their body, they're usually given some type of dissolving medication in the hopes this won't happen, all right, that it won't go to the lungs. When the clots get to an area that they block blood supply to the tissue, anything that causes tissue death is an infarction. That's why when you go out of here into the clinical world, you're going to hear myocardial infarction. They are not going to say heart attack, okay? They're going to call it the MI, the myocardial infarction. And basically, you end up getting heart attack, depending on where that occurs in the heart, determines death. A stroke is where there's a blood clot in the brain tissue. And once again, the severity of it is determined based on where it's found and how big and how much tissue damage there is. The goal, of course, prevent the clots from forming. Vitamin K is a good vitamin that we need for those clotting factors. Coumarin, warfarin, they are antagonists to vitamin K. You've probably seen the commercials on TV about some of the newer medications like Eliquis and stuff like that, and it says, oh, this only interferes with one of the clotting factors rather than 9, like warfarin or something like that. Okay, so they're coming out with better, well, I don't know if it's better or not, but they're coming out with different medications that are treating people that have blood clots and so forth. The aspirin, sometimes people take an aspirin, and it's to help keep their blood thin. Aspirin actually affects the thromboxane, keeps that from being formed, which is going to affect the blood clotting factors, which is going to keep the blood flowing more freely. But that also means if you get a cut or something, it takes longer for the blood to clot. Sometimes, and I love this one right here, the leeches. In the early times, okay, before we knew a lot of the stuff that we know now, doctors would treat a lot of ailments with leeches. They believed that the person needed to bleed and form the new blood, okay? And it's really cool. You know, y'all ever been attached by a leech? Okay? Well, you don't feel it attached to you, okay? Because when it attaches to you, it has a painkiller, okay? And then it just sucks the blood. It's really cool, okay? And then it hurts when you cut it off. All right, that's when it hurts. But what we're finding, they are beneficial. For example, people who may have lost some limb or part of their fingers or toes or whatever, they're finding that after the surgery of reattachment, if they apply a leech, the leech is pulling blood to that area, getting the blood flow to return. And it's really cool, you know? You don't feel it because the leech just kind of sucking on it. And then, of course, lots of things can happen with the snake venom. Don't even want to go there. Other things that they can do for management of blood clotting. If one has already formed, there are different medications that they can give to help dissolve the clot. Streptokinase, this one comes from a bacteria. This is the one that people who've had a heart attack, a myocardial infarction, this is what they'll mostly be given, because it's been shown to help dissolve the clots in the coronary vessels. We have TPA. Anyone encountered this one who's already in the medical field? TPA. When a situation is occurring and the doctor has to make this decision, this is a very important decision for them to make. It's a life or death situation. They can either save that person or they're killing that person if they administer TPA. Okay? TPA, very quick to act. And usually there's a pulmonary embolism, for example, and the person's pretty much, out, and the doctor has to decide, am I going to give this to them? But the problem is, because of the dissolution to the blood that occurs, it occurs so rapidly it can cause them to bleed internally and hemorrhage internally, and they can't operate to stop it. So the person will die. So it's a very critical decision that is made when you have to use TPA. Hamilton, the leech, that's one that they'll use, for example, when people have had their reattachment surgery. So it's really kind of cool. But that officially ends chapter 18 for us. We'll start 19 on Thursday.